I'm Beth Morris, Director of Community Health Partnerships for Columbus Regional, and I have the privilege of leading the prevention team, a group of 30 community professionals and community volunteers who've worked very hard over the last year to really bring a focus on prevention. So we live in that green circle around the system of support. Rhonda provided a great segue to this slide, which I stole from, it's not there. There's a really nice slide that Dr. Walthall developed that talks about education leading to understanding, leading to empathy, which brings hope and ultimately recovery. And I think that sequence really makes a lot of sense and really helps frame a lot of what the prevention team has been working on. So let me talk about, I shared in October, so indulge me while I repeat this metaphor, because I really want everybody to have a common understanding of what prevention is. And we talk about working upstream. What does that mean? So the metaphor is about the river, and people are being rescued because they've fallen in, and they have to be saved because they're drowning. And so our intervention team, our treatment team, our recovery team are all doing that very important work of trying to pull people out of the river of addiction. But the prevention team is focused in a different spot. We're really focused upstream to try to figure out, why is it that people are falling in the river in the first place? What can we do to fix the guardrail that seems to be broken? And so that's a lot of our focus. So we have 3 upstream strategies that have guided our work. We can increase awareness of the dangers of opioids. We can help diminish the desire to use drugs, and we can reduce access to opioids. One of the primary ways that we've worked on increasing awareness is to have a cadre of 18 community trainers who Nikki Vreeland from the Healthy Communities staff has prepared to go out into the community and present key information to any group that is interested. And that invitation continues. So if you have a group that you think could learn a lot about what they need to know, so that we can be the smartest community in the country about opioids, let us know, and we'll be happy to make a speaker available. We try to measure everything we do, and the way we do that with community presentations is to have a pre-test and a post-test. And to date, 98% of the people at the end of the presentation have demonstrated increased knowledge about the key messages that we're trying to share. So in addition to speaking engagements, we've hosted community events, such as this one. Just a couple of weeks ago, we hosted Nick and David Sheff, who have a very personal story about what their family has gone through addiction and recovery. And we're pleased to have one of the 3 presentations that they made was at the schools, so that parents and their students could learn from the chef's example. We use Facebook and Twitter. We've had wonderful support from our media partners at the Republic and White River Broadcasting. And any number of things have happened organically in the community that we didn't have anything to do with initiating. So let me just give you a couple of examples of that. The 8th graders at Central Middle School last school year created an awareness campaign of their own. They studied what was important to understand about pills and about why people take pills and how addiction works. And they educated one another, and then held a carnival that was a fundraiser for ASAP prevention, but also educated the rest of the school who came to the carnival. Viewpoint Books hosted a concert with a singer-songwriter who's a recovering heroin addict. Another way that can reach a different group than the folks that come to our presentations. We Nikki just finished working with a high school senior who did a really creative video that focused on the brain involvement with addiction. He really dummied it down to make it a lot more understandable to his peers in high school. We also certainly want you to make sure that you go to the ASAP website. There's a treasure trove of information there. There's toolkits, there's parent tip cards, there's a lot of resources that we bring to your attention, and a really inspirational blog. So do take advantage of that. So those are some of the ways that we're doing increasing awareness. So what about diminishing desire? Well, that's a big one. That's kind of a daunting one, but it's so important. I shared with you at the October meeting that we were working with Goodwill Industries of Central and Southern Indiana to bring the Nurse Family Partnership Program to Bartholomew County. And I'd like to acknowledge Lisa Crane from Goodwill Industries, who's in the audience and has worked tirelessly to help make that happen. And our very first nurse has been trained. Mandy, wave to the people. She just went through extensive training and is now accepting referrals. So again, this is a program that works with first-time low-income moms and not only helps prevent drug addiction in the moms and the kids, but there are all sorts of other benefits that the research has shown over the last 40 years are really important in terms of the economic health of the family, the educational attainment for mom and child. So we're thrilled that Mandy's here and that we're on our way. What else are we doing to diminish desire? We're very fortunate that our school corporations are absolutely on board with us, with these efforts. Just as the Elwood said, we really need to start young. So Bartholomew Consolidated, Flat Rock Haw Creek, and St. Peter's have all adopted the life skills curriculum, which really has been shown to diminish drug use by targeting the major social and psychological factors that can promote risky behaviors. So that will be starting in the fall. We have other schools that we're visiting. If you haven't heard from us, I can promise you you're on our list. But reach out to us if you're involved with one of the other schools. We would love to help you with that. And the Elwood Prevention Fund is critical to those efforts. We're also pleased to see community interest in helping young people develop the assets they need to be successful. If you haven't already heard about the 40 developmental assets and how we can all be asset builders, you will. There's a good deal of research about these developmental assets. 20 of them are internal to the individual, 20 are external to the person's environment. And the more assets a young person has, the more likely they will succeed, the less likely they will get involved with drugs or other risky behavior. So there's a clear sense that we can all help build assets in young people that we come in contact with. So we've talked about increasing awareness, we've talked about diminishing desire. The third strategy, if you'll remember, was reducing access to drugs. Dr. Terrell's doing the heavy lifting on this one with prescribing practices. But our role in the prevention team is to help ensure that everybody knows not to hold on to drugs that are no longer being used and to dispose of them safely. So a year ago when we launched, there was only one drug disposal box in town, and now there are 3. So CRH added one, and now CVS on National Road also has a drug disposal box. I don't know the numbers of the other 2 boxes, but I can tell you that in the 6 months that the CRH Emergency Department has had the disposal box there have been 200 pounds of drugs that have been turned in. And the take-back... So we also host drug take-back events like the one this evening. And I think within the first 2 or 3 minutes tonight, there were more drugs turned in than the last time we did a drug take-back event. So we thank all of you for cleaning out your medicine cabinet. We thank the Columbus Police Department and the Indiana State Police for making that activity possible, and to Johnson Whitkemper Insurance, who donated restaurant gift cards to reward the people that brought their drugs in. New tonight, an initiative to help you keep active prescriptions out of the hands for those who were not prescribed the medicine. We are very appreciative of a new partnership with the Children's Bureau, who provided a limited number of lock boxes and is interested in doing more. So I'm sort of thinking that some of you probably haven't heard a word I've said because you're still thinking about what Tracy said about this Project Prevent, and you're thinking about all the ways that you might take advantage of it. We are really excited about the community engagement grants that are available right now, just as Tracy stated. With deep gratitude to the generosity and the vision of Mark and Wendy Elwood, Project Prevent hopes to involve every not-for-profit group in the county. There are any number of creative and innovative ways that you can help increase awareness and, again, make us the smartest community in the country about opioids. Here's how it will work. If you're a not-for-profit organization, 501c3 in IRS jargon, or if you have a working relationship with a not-for-profit, we want you to consider applying for one of these grants. The application is on the Heritage Fund website right now, and will be on other websites as well toward the end of the week. Heritage Fund has worked really hard to keep this application. It's the simplest grant application I think I've ever seen, and that was intentional, because Heritage Fund really didn't want to intimidate or put any barriers up for groups that really might want to take advantage of this. So there are also going to be technical assistance resources available both on the website, and Nikki and I will be doing technical assistance workshops, completely optional, but if you feel like you need a little bit more direction or you want to run some ideas by us, we'll be holding some technical assistance workshops to help answer any questions that you have. So maybe you have an idea about how to get those medication lock boxes into your target audience, or maybe you're interested in the developmental assets and you think, oh, it would be really good if the coaches in our sports program understood how to build assets. Maybe you have ideas about an after-school program to introduce young people to different ways to enjoy life without drugs. Maybe you recognize that a number of young people in your youth group seem to have high levels of stress, and you want to help them learn ways to lessen that stress before they start medicating themselves with drugs. Maybe you'd like to bring a speaker to your church and host a discussion for parents about what to look for in a teen's behavior that you should pay attention to. The Children's Bureau also shared a very creative idea that I never would have thought of. There's a mobile trailer that has a teen's bedroom inside the trailer, and it's called Hidden in Plain Sight, and parents can go through the trailer, and there are 100 different clues in there of things that might be indicating that your child could be engaging in risky behavior. So it's a way for parents to kind of educate themselves. So you can see there's some really creative ideas out there. You may have better ideas than any of these. We really want you to be thoughtful and take advantage of this amazing opportunity. So we have, you've heard from everybody up here tonight that we need all of you. We need the whole community to turn this crisis around. So we do have one other request from you this evening, and you all have the We Know We Can paper in your seat. If you would take a moment to start a sentence on one of those sheets that says, I can, and then complete the sentence. Fill in the rest. We would love it if you would put that sticky note on one of the posters. There are 2 poster boards on this side, there are 2 poster boards on that side. So it's not time to leave yet. The best is yet to come, but we would like for you, we really do want to see your ideas, hear your ideas about the ways that you want to be involved.